Hello everyone, my name is Kimberly Pope. I am a student at ECPI University. I'm in nursing 456 in the BSN program. And today I'm going to be presenting the project that is required for nursing 456. Um, I did my project on UTI prevention in home health patients. According to research, four kinds of infections are the leading cause of hospitalizations in home health patients, UTI being one of them. In home health, the goal is to prevent hospitalizations in patients. With prevention comes education. In my project, my practical goal was to design, implement, and evaluate an educational checklist for nursing staff to educate home health patients on. The achievement, I was able to set a practical goal and achieve it through three different phases: design, implement, and evaluate. Each phase had an objective followed by learning strategies with evidence of accomplishments. Design phase, research and analyze evidence-based practices to reduce UTIs in home health patients. Implement phase, implement the UTI prevention information checklist. And the evaluation phase, evaluate the project results and nursing feedback. Of the learning strategies, I'll be speaking on learning strategy of finding evidence-based guidelines on preventative measures to reduce UTIs in home health patients. And the other one is creating a list of instructions for nurses to teach UTI prevention. Here you'll see evidence-based guidelines for the provided top five evidence-based guidelines to prevent UTIs. One of them being healthy voiding habits. The evidence was regular voiding habits reduces bacteria growth. The guideline was void every 2 to 4 hours, urinate after sexual activity, and do not hold or delay urinating. Another one was good perineal hygiene. The evidence was proper hygiene reduces bacteria that causes UTIs. The guideline was females wipe from front to back, avoid bubble baths, avoid powders and sprays in the perineal area, promote and educate on proper hydration. This continues the top five guidelines. Educate and monitor for signs and symptoms of a UTI. The evidence was sooner treatment starts, the less likely, the more severe complications. Guidelines was to teach the signs and symptoms to watch out for, such as burning when urinating, flank pain, frequency or urgency, cloudy or bad smelling urine, confusion, especially in the older population. Avoid catheters. Another evidence-based guideline was avoid catheters when they can be avoided. The evidence was catheters proven to pose the highest risk for UTIs. The guideline was perform intermittent catheterization when possible and only use catheters when medically necessary to use and remove the catheter as soon as it can be removed. The goal in home health is to educate our patients and prevent any hospitalizations. The checklist is designed for nurses to use for educational purpose for prevention of UTIs in home health patients. Home health visits are done once or twice a week, depending on the needs of the patients, and these visits usually last the duration of 2 to 4 weeks. So when nurses make visits, the material must be broken up in sections, so the patient can memorize what's being taught and it's not too overwhelming for them. This checklist was designed to be user-friendly to guide home health nurses in a way that the sheet covers what the important information needs to be covered. Um, and that way the information doesn't overlap. And this also serves as a checklist. The nurses can check off what they've already taught. That way they don't go back and reteach anything. They keep moving forward since we're limited on our time in the home with patients. Here is a example of the educational checklist that I designed. The outcomes for the project were designed to implement a checklist that would be beneficial to the agency as well as the patients. The checklist be user-friendly and be used agency-wide, and nurses find it useful, and all these outcomes were met. This project has not This project has been valuable to not only me, but to my mentor. It was a huge success with my mentor, and I was also able to work with my colleagues. They all played a huge role in this project, all the way from helping me come up with how to design it to the feedback they provided, and then the nurses implementing the checklist and see if it was useful or not. Um, Not only did I learn some valuable information, but I was able to implement an educational piece to my agency by designing the sheet, and now it's used agency-wide for all the patients. Usually, when home health patients are admitted, they have what we call a mission packet. So now this educational checklist will be in all the patients' start of care packets. So it's in there for all the nurses, for all the patients to have. And here's my works cited page. Thanks.